She was 35, fit, ate clean. Her blood pressure? 120/80. Perfect, her doctor said. But one morning, she collapsed in her kitchen. A stroke. Out of nowhere. How does someone with normal blood pressure end up in the ICU? Because 120/80 isn't truly normal anymore. Not for everyone, and maybe not for you either. You've been told that 120/80 is the perfect blood pressure. But what if I told you that's outdated and maybe even risky for your body? For decades, we've heard that 120/80 is the gold standard. Doctors, posters in clinics, even school textbooks said the same thing. But here's the truth. It wasn't based on what's healthiest. It was based on what was average for people at the time. Not ideal, just common. And many of those people? Older, sedentary, already showing signs of hidden damage inside their arteries. So why are you, a young adult, someone trying to live well, being told to aim for their numbers? Let's look at what the science says. Even within that so-called normal range, your risk of stroke, heart failure, and kidney damage can quietly rise, especially if you already have other risk factors. In a massive study of over 9,000 people called the SPRINT trial, those who lowered their systolic BP below 120 had a 25% lower risk of death compared to people who stayed around 125 to 130. And data from the Framingham Heart Study shows that even going from 110 to 120 raised the risk of heart attack and stroke. So while 120/80 might be considered normal, it's not always optimal, especially not if you're under 40 or if you're already at risk. Here's where it gets serious. Even if your BP is 120/80, your vital organs, your heart, your brain, your kidneys, could already be under silent stress. People with diabetes, early kidney issues, or undiagnosed heart changes can suffer from something called masked hypertension. That means your BP looks okay at the clinic, but inside, it's already doing damage. Your arteries stiffen. Your heart starts working overtime. Your brain gets slightly less oxygen day after day, and you feel nothing. But there's good news. This silent damage can often be reversed if you act early. So if 120/80 isn't the safest goal for everyone, what is? Most studies now point to an optimal range, between 110 and 115 systolic and 70 to 75 diastolic. That's where the lowest risk of heart attacks, strokes, and early death tends to fall. But that doesn't mean lower is always better. If your BP drops too low, especially if you're older, you might feel dizzy, weak, or foggy. The goal isn't just a number. It's how your whole body feels and functions. And not all bodies are the same. If you're South Asian, your arteries may be more sensitive to even small increases in BP. In fact, studies show South Asians have strokes and heart disease at younger ages and lower pressures than Western populations. And for women, especially those with PCOS, endometriosis, or hormonal shifts, even a BP of 118/78 can quietly affect circulation over time. We actually made a full video on the hidden causes of high blood pressure at a young age, from kidney issues to insulin resistance. Check it out if your BP is high, but your tests keep coming back normal. But don't panic. This isn't about fear, it's about awareness. You can take charge. Start by checking your BP at home. Use a proper arm cuff. Sit quietly, take 2 readings, and do it consistently, same time each day. Then ask your doctor to go deeper. Request tests like an ECG, urine protein, a heart ultrasound, or even an eye exam that can spot early pressure-related damage. Next, build BP-friendly habits. Sleep 7 to 9 hours. Cut sodium below 2,000 milligrams a day. Eat magnesium-rich foods like leafy greens, almonds, and avocados. And walk. Just 30 minutes a day can lower your numbers more than some medications. And most importantly, don't blindly trust 120/80 as your finish line. Listen to your body. Understand your risks. Be proactive, not reactive. Because what's normal for the average person might not be safe for you. So, what's your current BP? Drop it in the comments and let's talk about it. And if this video gave you a new perspective, send it to someone who needs to hear this. Because the real danger is thinking you're safe when you're not.